All right, thanks for having me. How you guys doing? Feeling postprandial coma yet? No? All right, it's a really great opportunity to be here with you and talk to you about the opportunities we have in public health to transform and promote great change, and it's great to be in person. I do want to highlight the importance of us always being self-aware about the strength in serving and the importance of taking care of yourself, your family, your friends, and then, of course, thinking about the work, because I can only imagine that the work that each of you do is incredibly challenging and exhausting as I've listened. So highlighting the importance of strength in serving, and this is my family, you can see, aren't they cute? My daughters, is really important to keep that foundation of why are we here, who do we have to be here for, and how do we have to care for ourselves to be able to care for others. So I do want to highlight, I am going to try to convince you the importance of partnering with healthcare organizations and the private sector in the efforts around public health. And my roots are based in community health centers as a National Health Service Corps scholar, and also having really serendipitously been in settings almost like Forrest Gump in the federal government, where I was there during the period of the Recovery Act and the Affordable Care Act. I was lucky to be the chief medical officer of HRSA, an important agency that I suspect funds and supports a lot of your work, but also serves many of the communities that you're looking to serve as well. What led me to think about other settings was the fact that I felt as a primary care physician, what I could do in the exam room was limited, and that I wanted to go further upstream and understand the systems that played a role in what was impacting my ability to care for those patients and those families. Part of my time in training and education, I was at the Kennedy School of Government, and I remember reading this book and learning from John Cotter the importance of how you lead change. And the theories of change really played a role in ways that I was able to apply throughout my career. A couple key aspects I want to highlight is the importance of coalitions, the diversity of those coalitions, the importance of partnerships, and also thinking about that vision and how you communicate that vision. And I'll articulate a vision that I think is important. Health equity must be profitable. In order for us to scale it, we have to figure that out with these diverse partners. Using language is also very important. You need trust brokers, because many of the cultures of healthcare, the private sector, and governmental public health are different. So you have to be self-aware of those biases that others may have and build that trust. So change requires trust brokers. As I think about the framing of public health, and taking my daughters, my older daughter loves plays, and so Ella loved, what play is this? Hamilton. I mean, so we love, so when I think about Hamilton and so many things that you can learn from that, but I love, the reference to the topic of being in the room where it happens. And so as you think about the table or the room of public health, who are those stakeholders who often assure the conditions for a population's health? Where do those stakeholders come from? Where are their biases? Where are their incentives aligned? And so I love, and I recall reading this in my federally qualified health center, Unity Healthcare. A friend of mine, Rose Martinez, gave me this book from the Institute of Medicine. And I remember the one graphic thinking, wow, this is what helps assure the conditions for the people I serve. These stakeholders working together. And that quote from C. Everett Koop, the former Surgeon General, healthcare is vital to all of us some of the time, but public health is vital to us all of the time. And the concept that we are all public health. So I would hope that our language I like to say I'm often a public health professional in the private sector. Do you guys like that? You can clap that. I saw one clap. There was one clap. So I'm going to give you a little bit of an insight towards the different sectors that often we don't think about. Healthcare, or we think about, but we're frustrated at how much money is spent in these sectors, right? Like, why do they have so much money? They have 95, 97 cents on the dollar compared to what we have. And I'm going to reference this quote from Sister Irene Cross, a hospital administrator who gave this phrase, no margin, no mission. She had an MBA. She was the first woman to serve as a chairperson of the American Hospital Association. And we now know half of all hospitals are in the red in this next chapter of the pandemic. Many of them are struggling to stay alive. And many are questioning how they will deliver on their mission without sufficient margins. So, what's the term we often use? I remember learning this about the history of medicine at Yale as an undergrad, how hierarchical healthcare is. We call them patients. In some ways, it's not the most empowering term. Be patient, be quiet in a waiting room. But these are the 7 Ps of healthcare. You follow the money and the data. And when you think about your work, think about these partners. Think about, of course, the providers. We know that in many communities, you can have a federally qualified health center, a local health department, but typically large hospital systems, which are consolidating more than ever. 70% of hospital systems are now from large systems. 90% of those beds are part of large systems. Payers have a significant role. There's primarily just 5 of them now. United, Elevance, Aetna, Cigna, Centene, the Blues. There's a big role that they have in understanding that broader system. How do you partner with them? Purchasers. This is something I learned at my time at IBM. It's extraordinary to think about the way in which an employer has the authority to make policy without any legislation, to decide that primary care is covered, to decide preventive services are covered, not only domestically, but across the globe, as I was able to do at IBM. Policymakers, of course, which are state, local, federal stakeholders. Producers, so yes, pharmaceutical companies, medical device companies, health tech companies. And then I really put you in this category. You could be in any of these categories. I know you can you don't have to be in only one, but this idea of trying to pioneer and disrupt the way in which health and healthcare is delivered. And it is hard. Healthcare is one of the most conservative industries that exists. But I also view researchers, academicians, startup companies in this category as well. So think about how those Ps work in your community or don't work together, and the unique perspectives that each of them may have in terms of serving that same patient. So, one other framing that I like to articulate from a healthcare perspective, beyond the 7 Ps and following the money and the data, is you think about your endeavors to partner and collaborate and get into that room and advance a goal of the public's health, is the evolution of what I call values-based care. We've learned now, as a result of this pandemic, that our health system is not meeting the needs of the communities that we need to serve. We've discovered that there are other curves that need to be flattened, that were always there, but have gotten worse. Chronic disease, infectious disease, many other infectious diseases have proliferated during this pandemic as people have not gotten vaccinations or not gotten certain treatments. Mental illness has nearly tripled in terms of detection, and much of that is undetected. Substance abuse and inequities. And so what I like to say is that we have this window now to pretty much call it as we see it. This pandemic has exposed these 4 other curves, or these 4 curves of COVID, infectious disease, chronic disease, mental illness, and inequities. And we must challenge the system and the folks in the room to expect better and deliver on a values-based system. Something where we value prevention, science, equity, mental health, community. And I do reference here Don Berwick's piece. He's the former CMS director and highlighted what I would call a big threat to our values-based system, the existential threat of greed in our healthcare system. So let's now pivot to this last sector. I talked about the broader public health, the framing, the room, the importance of the healthcare sector, which often has 95 to 97 cents on the dollar, where you have to look at those 7 Ps and understand those different stakeholders in a community, but also at a national or state level. But let's talk about the private sector. When I made the jump from HRSA nearly 13 years ago, and I remember talking to Dr. Wakefield about my transition, simply put, I felt I could do public health in the private sector, and I believe I have. But I will tell you, I learned this quote really resonated with me, because as I look at this room and the people I've met here, and I look at the people I've met in more of the private sector, I would suggest the private sector needs a lot more diversity, especially at the C-suite, especially at the board level. And so this quote, that you can't be what you can't see, is something that I often believe is so fundamentally needed in the private sector, which is why I'm encouraging those of you who have not considered it to consider it. And so I remember we would have top-to-top meetings at IBM, at CVS Health, Aetna. I was often the only minority in the room. So we need more diversity in the private sector. We need more public health professionals in the private sector. And there are opportunities for you now in the private sector more than ever. There is a rise of what I would call chief health officers or public health officers in the private sector. Delta hired their first one. Dollar General hired their first one. Disney. We've been hiring chief health equity officers at CVS, at all those larger payers. Google, Amazon, Meta. There's a need for us to recognize that there's an opportunity here for thinking with a public health paradigm and assuring we're integrating humanism and capitalism. And one of the terms that I was fortunate enough to evolve in my time in the private sector is the concept of TechQuity. This idea that our workforces have to be as diverse as the people they are meant to serve, which in health tech and healthcare, we're not meeting that need or expectation. The fact that data and trust is so foundational. Trust is foundational before you collect someone's data. The fact that equity dashboards, in many ways, equity was the Rodney Dangerfield of healthcare metrics at the turn of the century. Safe, timely, effective, efficient, equitable, and patient-centered. Equity was not as valued, so we need to create dashboards that clearly demonstrate the inequities that exist and expect that our values-based system incentivizes the elimination and reduction of those inequities. And then now, whether we like it or not, AI is here to stay. And part of what worries me about the AI that's being used is that it's not as ethical, not as transparent, and not as equitable as it needs to be. So in many cases, if you put data in that doesn't represent the population it's meant to serve, you'll have outcomes and recommendations that basically maintain the inequities that already exist in the system. The other piece, this was some work we did with Robert Wood Johnson Foundation. There was a grant. I remember trying to advocate in front of the RWJ board to have a corporate health leaders program and say, look, Risa and board, the corporate system, the corporate America, I am disappointed that the same network that I had in the public sector and the nonprofit sector doesn't see the opportunities in the private sector. So there was this program that Howard Koh and the Harvard School of Business and the Harvard School of Public Health funded, which evolved to this book and some other programs. There's a MOOC course on this that highlights that every company is a health company, and about these 4 dimensions or pillars that every company can address. And so if you think about any company, even a small, 1 employee or 10 employees, to a large company like IBM, which had 50,000 employees when I was the chief medical officer there, over 170 countries, you actually express your health in each of these 4 pillars. The first one is consumer health, what you sell. And so when Dr. Troy Brennan helped recruit me to CVS, and he told me the story of how CVS gave up tobacco in 2014. Yeah, come on. And lost billions of dollars of revenue. But it's so fascinating the way he talks about it. He's like, it was a failure, Kyu. I'm like, why? No one else followed us. None of the other retail entities followed our lead. So there's still an opportunity for that, right? But this idea that as a company you could think about what you sell and promote health is so foundational to consumer health and the role you can play in terms of every company being a health company. And this is a great example, and there was a great study in the American Journal of Public Health which showed that reduced tobacco rates in those communities, especially where CVS was the predominant pharmacy. This is the first nursing home resident who got the vaccine in December of 2020. So you gotta imagine organizations like Pfizer, Moderna, Walgreens, CVS, Walmart, they also had an important role in bringing us out of this pandemic. And so thinking about those public-private partnerships and the role the public sector or the private sector has in public health is incredibly important. What's that? There it is. The next pillar is employee health. And I love thinking about this in terms of the work that employers have as purchasers in those Ps to decide on a policy. I had so much pride in the work we did at IBM, where in most parts of the world we created the same criteria the Affordable Care Act had in eliminating pre-existing disease exclusions, in assuring preventive services, in covering family planning, prenatal care. You are ultimately a policymaker in terms of how you buy your care in the system. You don't have to go through some major legislation at the state, local, or federal level. Wait, why did we go? Oh, we went back. Let me see. Oh, no. Environmental health is another role. So as I was referencing, healthy business, healthy workforce, but then how you impact the planet, how you reduce carbon emissions is also another important role. This is a great work of a global initiative bringing large companies together around getting to zero carbon grids at scale. And then this last one is community health. And so large companies and organizations have foundations, they have corporate social responsibility, they have ESG commitments, and they have work that they do in that community. I love this acronym. I use it when I was at the Commissioner for a Healthier America at RWJ. Health, housing, education, access to healthy choices, labor and employment, transportation, and healthcare. And so we did a lot of work in supporting these health zones, and we're still doing that work, but that is another example of how a company can deliver community health. And these are just some examples of what I've witnessed. So in summary, basically at 20 seconds, I'm right on time, that's good. Change requires trust brokers. All of us need to be in that room and bring those other stakeholders together. We need to think across the 7 Ps of healthcare and make sure we're delivering mission and margin. We've got to lead to a values-based system. We need more diverse populations, public health professionals in the private sector and the healthcare sector, which often has got too much underrepresentation of groups that often are represented in nonprofit and public sector. We need to recognize that there are opportunities in the private sector to influence public health with the rise of chief health and chief health equity officers. TechQuity is a great framing as technology becomes more and more prevalent in terms of how we deliver care and public health. We need to make sure that technology doesn't maintain the same inequities, but actually achieves health equity or leads towards health equity. Every company is a health company, and there are opportunities for you to have a role in consumer, employee, environmental, and community health. Gracias. Thank you.